Are you thinking about applying to NP school, or have you already started to apply to NP school? Or are you like, should I or shouldn't I? Well, this video is for you. Stay tuned. Hi everyone, welcome. My name is Blessing. I am a cardiac nurse with over 5 years of experience, as well as a PMHNP student. In case you're wondering what are all those abbreviations for, that just means psychiatric mental health nurse practitioner student. Currently in my final semester. We're almost there. Welcome. This is Vitals and Vision Nursing for your one-stop shop, everything nursing related. So whether you're thinking about an advancement in your career, leaving bedside nursing, joining bedside nursing, or even becoming a nurse, this is where you'll find the answers to all your questions. So if you haven't already seen the introductory video, please go watch that. It just gives you a brief introduction of what this channel is about. In this video, we will be tackling one of the most asked questions that I get asked a lot about, which is why NP school? Like, why would you want to torture yourself again? Was nursing school not enough? Girl, it was, but let me tell you my why. So like I said, I have been a cardiac nurse now for over 5 years, and I absolutely loved it. I have grown so much from a baby nurse to where I am right now. I've had charge role responsibilities, been a charge nurse. I've been privileged to educate new nurses. I've worked with GNs. I've witnessed lots of hard cats. I've witnessed lots of stents and even cabbages. So I've had my fair shares of nursing related cardiac stuff. What made me want to go to NP school was I just felt like I needed more in my career. After a while of doing bedside, for me in particularly, I wanted to have a little bit autonomy when it came to my patients' healthcare decisions. I wanted to feel like I could do more for them. Do you ever have that one patient that you kind of grow fond of and you're like, man, I wish I could refer you somewhere. I wish I could do something more. I wish I could follow up, in a week's time just to know, like, did you actually take those medications? How are you doing? Some patients do leave those lasting effects on you as a nurse, and I've definitely had my fair share of those patients. So with over time of doing bedside, I always felt like I wish I could do more than just carry out doctor's orders, to be able to educate, prescribe, and even diagnose certain things that go missed sometimes. As nurses, it's important to know that you are the eyes of the providers. The providers, they see the patients, but not as often as you see the patients. So you know your patients better than the providers. Don't ever let anybody else tell you otherwise. You get to know and see when a patient's symptoms are changing before the doctor even sees them. So don't ever second guess what it is that you're seeing in your patient. If you've had a patient now for 3 days and you're noticing, wow, this patient is becoming a little bit more confused, trust your gut, trust your instinct, and notify that provider. So I've had several instances where I felt like I needed to be able to do more, and I just don't have the groundwork or the skills to do more. And that's when it clicked to me that, hey, it's time to level up. And the only way to level up is to go back to school and get that NP degree. Now you may be wondering, why psych? Why not just get, you're already in cardiac, why not just continue cardiac? The reason I chose psych is because, unfortunately, in my community, the African American community, the Black community, mental health is something that is not very talked about very much. It's almost like a stigma. It's very frowned upon. It's looked down on. And I see so many kids coming through the ER, or so many elderly people coming in through the ER, and you can tell that they're struggling with something emotionally, but they just don't have the right words or the right tools to vocalize what it is that they're feeling. And for me, mental health not only looks at, the younger generation, but it also looks at the older generation. And I feel like if I can start while they are young, then hopefully we can prevent problems when they are much older. That is just my 2 cents. Obviously, I can't save everybody, but I am determined to try to make a lasting impact in the lives that I can. That's why I'm a nurse. So things that you should know before you decide to apply for NP school. One, NP school, and there's NP school. So some NP programs basically feel like you're teaching yourself. So if you are somebody that is able to learn on your own independently without being in a classroom setting, then okay. Other programs require you to find your own preceptors, while some programs will assist you in finding a preceptor. So if you have good networking skills, then finding your preceptor may not be a problem. But if you're like, no, I don't really know how to network, I need somebody to assist me with finding placement, then you may want to look into a school that helps with finding preceptors or that assigns you to preceptors. So like I said, there's NP school and then there's NP school. Second thing is NP school will humble you. Time management is extremely, extremely important. So whether you're a mom, a single mom, or life is just lifing, it's doable. It's doable, it's doable, it's doable. I went into nursing school being a single mom, and I did it, and you can do it as well. Now, everybody's support system looks a little different, but definitely utilize the support system that's around you if you do have one. But just know that whatever your situation is, with a little grind and a little faith, is doable. So time management is extremely important. Like I said, a lot of NP programs, you are having to teach yourself. It requires you to do seminars. It requires you to just listen to the professor talk and then go back and do the groundwork, which is reading through the textbook and taking exams. There's nobody that's going to come knocking on your door and say, hey, it's time for you to wake up. Did you submit that assignment? No, they don't care, because they believe that you've gone through the program, you've gone through RN school, you've done your BSN, so you should be professional and mature enough to handle a graduate program. So there's no really babying you or holding your hand through it. Some professors are kind enough to where they will send you gentle reminders like, hey, don't forget, there's an assignment due. But overall, you are learning on your own, and you are responsible for meeting your deadlines. The third thing is a 4.0 GPA does not guarantee you a preceptor. What does is networking. So if you are currently working in a hospital settings, please talk to your doctors, know your doctors, learn your doctors, familiarize yourself with the providers that you work with, because those are your best networking people. When it comes to finding preceptors, networking is everything, okay? A lot of places now charge you to preceptor you, and it can be anywhere from $1,000 to $2,000. And being in school is a struggle enough. Imagine having to pay $2,000 to somebody to just shadow them. I don't think so. So definitely network. Get engaged. Let your providers know, like, hey, I'm in NP school. I don't know if you're taking students. When it gets time to clinical rotations, would you be willing to preceptor me? That is how I did mine. It worked, okay? I am that nurse who talks to everybody from the kitchen staff to the respiratory therapist, to the lab people, to my fellow coworkers. I believe in being social. I believe in networking, and I just believe in getting to know every single person, because the truth is, you never know when you're going to meet them. You just never know. If I have lab questions, I know my lab people to call. If I have respiratory therapy questions, I know who to call. So do not be that standoffish nurse who doesn't really talk to people. I'm not saying go talking to the whole hospital, and we don't got time for that. We have call lights going on. We just don't have time for that. But socialize, get to know the staff, get to know people, and most importantly, network. The next thing I would say about NP school is that it's very much doable, but you have to know your why. Knowing your why when it comes to nursing and everything else is extremely important, because unfortunately nursing is one of those professions where people get easily burnt out. Now, what keeps you going is your why. So are you going to NP school because it's trending and because everybody else is doing it? No. Go to NP school because you want it to align with what your goals and your purposes are. What is it that you're trying to do in the long run? Are you trying to be a provider? Are you trying to open your own business one day? Are you trying to, have more long lasting relationships with patients? Are you trying to have that autonomy of being able to prescribe, of being able to diagnose? You have to know your why, because that is what's going to keep you going every single day when those days get tough, when you don't feel like studying, when you don't feel like seeing 25 patients in one day. That is what's going to keep you going, is your why. If you know your why, and it's not because, like I said, it's trending and your girlfriend did it or your friend did it or your best friend is in NP school and now you want to do it, then you're going to find it so much more easier going through NP school. So knowing your why is extremely important. I hope this tips helped you. I hope that you were able to find something from it. And as you journeying into NP school, make sure you're doing your research, make sure you know your why, make sure you have good time management, and make sure you network. Those things are really important to be a successful NP student and to come out on the other side as an advanced practice nurse. Once again, thank you so much for joining, and thank you so much for tuning in into this episode of Vitals and Vision Nursing. I hope that you learned something, and don't forget to comment below and let me know, are you in NP school? Are you thinking about going to NP school? And if so, which part of NP are you thinking about? Is it geriatrics? Is it mental health? Or is it just family practice? Let me know below in the comment section, and I look forward to responding to you. See you soon, and see you in my next video. Bye.